Very good morning to you, Blaine, and the viewers at home. With the possibility of a third wave hitting the country, the Eastern Cape government wants to make it a point that it is ready and it is prepared to fight the spread of this virus. And part of doing that is to open more hospital wards. I am here now at the Cecilia Makiwane, where the Eastern Cape government will be opening a new ward that has been built to prepare for the third wave and also to improve the healthcare systems in the province. But joining me on this is the MEC for Health, Ma'am Nomakosazana. Ma'am, thank you very much for your time. We appreciate that. Kindly tell us about the idea behind this building of this ward.
Thank you so much. We are here today as a result of the kind gesture of the German government and working with Siemens South Africa. They've donated a modular structure which is 100-bedded here at Cecilia Makiwane Hospital, with 10 beds being ICU beds and the other 90 being general ward beds. So we are doing that. We're coming here to receive now that structure so that we prepare ourselves, as we all know that there is an anticipation which is almost certain of the third wave. So we are here today to say the people of the Eastern Cape, when this pandemic again surges again, will be able to have enough space to fight this pandemic. And we are happy of the timing and of the continued partnership we are having, in particular with the German government. As we all know that they also assisted us with the field hospital that we had in Gqeberha. Now we are here and there's a lot of work that we are doing with them. So we are saying it is a great partnership that works.
All right, we understand that now there's going to be a second vaccination, which is the max vaccination, and which marks the end to the first phase. Kindly tell us about the experiences of the first vaccination. How was the response from the healthcare workers?
Yeah, initially there was reluctance, and out of the 60,000 healthcare workers we are having in the province, only about 45,000 came forward to register. But we are happy to report now that we have exceeded 50,000 in terms of the Sisonke early access trials, which we are wrapping up because we are expected to start with the citizens that are 60 years and older from Monday. And we are well prepared to do that. But of course, even though we are saying this is a great progress that we are experiencing, we are still worried about the resurgence of the pandemic, because we have noticed that in the previous 7 days there's been about more than 50% increase across the province. So we are worried, but we are happy that we will be able to roll out the vaccination to other people now beyond the healthcare workers.
And then tell me, how do you plan on reaching out to the rural people of this Eastern Cape, as you understand that this province is mostly rural in terms of the vaccination?
We appreciate the partnership that we are having with all the government departments, as we'll be working together with them, and also our traditional leaders and the religious sector leaders and the communities at large, because we'll be using many hospitals and other facilities. We'll be taking the approach of using the hubs and spokes of our province, where we use the hospitals, but we work with the hospitals to access also the clinics, and be using community halls, schools and churches and constituency offices, and even the private sector facilities to roll out this second phase of our vaccination. And
then lastly, let me see, before I let you go, just your message to the communities of the Eastern Cape in terms of protecting themselves from this virus.
We appeal to our people to continue to be vigilant, to exercise care, because as we are saying, the numbers are going up now. They must continue with the non-pharmaceutical interventions of washing their hands frequently after every 20 minutes, sanitizing, keeping the social distance, and making sure that they always, all the time, have their mask when they are going out, because that's the only way that you can try to maintain the spread of this pandemic.
All right, thank you very much, MEC, for your time. Well, that was the MEC for Health, Ma'am Nomakosazana, saying that the Eastern Cape is ready for the rollout of the vaccination program. Also, in terms of the third wave as well, they are prepared. All the systems are in place, but she's also appealing to people to stick to the COVID-19 protocols. With that, it is back to you in studio.
All right, Lu-baba-lo Dada, thank you very much indeed for your reporting. Health Minister Dr. Zweli Mkhize has warned that strong action will be taken against people who are not eligible for getting the COVID-19 vaccine. The second phase, as you know, of government's vaccine rollout program will start on Monday next week.
We have sent people to go and check what has happened here. There have been, last week, for example, a number of people where we're told that